the last chapter, chapter 10, which is talking to your healthcare provider about it. It's one of the hardest things to do, I think, Dr. Mache, because we as patients believe that our gynecologist will proactively talk about it or let us know what we need to know. But that's not the case, is it?
No, I mean, for the people that I see, I give an hour for a new patient. Most people are getting about, much less than that. The problem, the
Oh, I
issue,
can tell you it's about 15 minutes and it's the equivalent of a pap smear and how are you doing?
right. And
So,
the thing about it is that it takes time to go through a person's whole story to personalize what it is you're taking. When you go in, if you do have this book, The Estrogen Fix, if you do have it, if you read it, what you'll find is what the North American Menopause Society said is not only recommended for patients, but also for their doctors because of the references. And there's 11 pages of index in the book that can help you find what you want if you don't want to read the whole thing. But you really need to come in proactively and be informed to become a partner in your healthcare. Because if not, you're going to be having somebody who has their own ideas that may be good or bad. And if your doctor is thinking that estrogen is bad for you, you have no chance to get it. I have women that I have seen. I had one patient that came in. She decided she wanted to go to get hormone therapy. She went to a doctor who went to a really good medical school and graduated, but was under this impression of estrogen was bad, and she wouldn't give it to her because she said, I don't want to read about you in the obituaries.
oh, geez.
So she was frightened to death. You also need personalization on which one of the estrogens is best for you. And I know there's a lot of talk about bioidenticals, and I do want to say very briefly that bioidenticals, it means, is not a real word. It's not a medical word. It's a marketing word. And bioidentical implies that the structure of the hormone is the same as what's made in the body. Bioidentical. But the bioidentical hormones that you get in compounding pharmacies do have some risk to it because in studies that have been done, what we have found is that when a prescription is sent to 12 different compounding pharmacies, and that prescription is filled and sent to a chemical analysis lab, the dosages that are prescribed end up being all different from each other, with estrogen being as much as 80 to 200% higher than what was ordered, and with progesterone being as much as 60 to 80% lower than what was ordered. And this is just because it's very hard on a one-on-one basis when you're mixing it up one at a time to get it right. And it's not that they are making an error. It's that the estrogen is put into a big vat of a cream or something else and stirred up. And just like when you put M&Ms in the vanilla ice cream, some scoops have more and some scoops have less of those M&Ms. And that's the issue. Whereas you can get the same bioidentical hormones in a regular chain store, drugstore, and that's every patch, every one of those sprays, gels, creams is FDA approved. The pellets and the ones in compounding are not FDA approved, and therefore it is what it is. I'm not against them, but your doctor then is going to have to check you carefully. You want to get a baseline evaluation of your uterus, a baseline evaluation of your bones. You've got to have an overview of who you are and then be ready to have a plan that's personalized. And it doesn't end with that visit. You have to come back and see how it goes in 3 months or 2 months, and then again. And then once it's more standard and once you're kind of happy, then you can maintain what you're on. So I'll stop there, but it's very important, this visit.
I think it's so important for us to know what we need to get tested. So could you just give us a quick checklist of what are the things I should walk into my gynecologist's office and say, look, I'd like to do a bone density test. What else? You mentioned uterine lining test. Tell us a little bit more about what are the tests we should be requesting.
It depends. It's a personal thing. It's an individual thing. But generically, you need to have a tested the uterine lining if you're going to get hormone therapy, so you know where you are, so you can see where it is. You might want to get baseline blood levels for your estrogen and your progesterone. You want to check your vitamin D levels. So many women are deficient in vitamin D today, and that's important for bone strength and for muscle strength and for mood and everything. You have to get, you will need and some type of evaluation of your GI tract. I like to get colonoscopies on people at that point in time. You mentioned the bone density. You might need to get a baseline EKG if it's not getting done. Cholesterol levels, check for your diabetes. There's a whole workup depending on the individual. And it just takes time to talk to that woman, to talk to you personally, and then to get what you need and make sure that everything is covered.
Absolutely. All right. Any last piece of advice, Dr. Mache, for someone out there who's suffering from a lot of symptoms and really wants to take charge of her life? What is the one big change she should make starting today?
I think the most important thing is to realize women are nurturers. They often nurture everyone else, but they don't take time to nurture themselves. So I just want to say that time spent on you isn't wasted or lost. It's invested. It's invested. And the ROI, the return on your investment, is going to be a healthier and a happier you. And the quality of your life is going to be much greater if you take the time to take care of yourself. Because if you don't do like the airlines say and get the oxygen mask on you first, you can't assist those who are traveling with you. So I would say take the time to understand what you need and then get what you need in order to live healthy, happy, and hormonally balanced.
Beautifully said. Listen to Dr. Mache. He knows what he's talking about. Prioritize your health. If you're getting to those 40s, you need to put your health as a priority. Make a list of things. Read Dr. Mache's book. The link's going to be available in our show notes. And get ready to take charge of your health hormonally. And of course, we have the Peak Menopause Bootcamp as well as the Hormone Health Bootcamp. Check out those. They will help you. They're designed by Dr. Mache. They include very specific recipes, workouts, meditations, supplements to make sure that you are going to have an amazing life. Thank you so much for joining. Dr. Mache, thank you so much.
Rena, it's always great to spend time with you. Be well.
Bye-bye.